And that's why I love this operation so much, because we've completely changed her shape. Sometimes people ask me, like, what is your plan? And I very flippantly say, like, it's just the Ogee, but it actually is, that is just my plan. In her situation, does she have enough fat? Yes, she does have enough fat. She's got a nice underlying shape, but there are some things that we can do to really change it. It would be sort of step one, which is the lipo, to create the concave shape. Step two is obviously going to be the transfer of the fat. And then the question is, where do you transfer that? I just follow this line here. When I see somebody getting flat as she is in here, then we're going to graft here to build out the line. I usually will graft fat from the butt into the legs to further that line. In her, there's going to be no transfer of fat to this area. And then the fourth thing is really kind of a balancing, I would say, of her butt. She's really very empty up here, but this area here is very nice. She's got really nice volume and a nice shape. So for her, it's going to be really more grafting in the upper part of the butt and not as much grafting in the lower part of the butt, so we can balance her. And this is actually quite a fairly common scenario where people will have quite a bit of flatness in the upper part of their butt, but their lower part of their butt looks really good, and they have a little flatness on the sides. So we just get the Ogee line to be able to get that nice shape, and then we balance her butt by adding more fat in the upper part. For some people that are more equally distributed with fat and we just want a little bit better shape and a little bit more fullness, then I tend to graft sort of throughout the butt. But in her, that step 4 is really going to be just balancing the butt, where we're going to be adding less fat to this area and more fat to this area to give her a nice rounder, sort of plump, fuller look. This is, to me, just absolutely phenomenal, because we can actually completely change her butt. This is what I love about this operation, where she had this real hollowness and flatness and heaviness, and this kind of stood out and she didn't like it. Now with this nice convex Ogee shape, this just flows right in. If you just look at her flow now, it's really pretty. And these areas that were sticking out before, they're not. Now they're just completely part of her body and just has a nice, smooth, pretty line.